Good morning, everybody, and welcome to Friends of Europe's event on healthy environment, healthy lives. My name is Tamsin Rose, and I'm a senior fellow here at Friends of Europe. 2019 was already a tumultuous year. We saw unprecedented melting of our glaciers. We saw enormous wildfires around the world and major disruption from extreme weather events. 2020 brought change in another way. The emergence of a new pathogen that the world had never seen, COVID-19, has devastated the world and has been found in almost every continent except Antarctica. Over the last 9 months, 4/5 of the world's workforce were affected one way or another, many of them forced to stay home. People have lost their jobs. Hundreds of thousands of people have lost their lives. 3/4 of the world's children were out of school for large parts of the year. So there has been an enormous impact on our economies, on our societies, and our communities. So what do the big changes of 2019 and 2020 have in common? The environment and health nexus. So if we needed further demonstration about why the two are connected, why we need to understand them together, the last 12 months have given us a sharp and painful wake-up call about what we need to do. So here at Friends of Europe, we're delighted to be having this discussion this morning, trying to unpick what it is that makes this close connection, why we cannot have healthy lives unless we have a healthy environment. And healthy environments will deliver us better working and living conditions. For those of you who would like to interact this morning, there will be opportunities to speak. Those of you who are on Zoom, please, your camera on, your full name, and if you want to, when I invite you to participate, you may raise your virtual hand. For those of you who are watching the live stream on Twitter, please use the hashtag #FOEdebate in order to participate. So without any further ado, I'd like to introduce our first speaker this morning, Mr. Hans Brinings, the Executive Director for the European Environment Agency, who's going to give us more of the background so we really understand this close nexus between environment and health, which has led to such 2 difficult years in the last 2 years. Hans.
Thank you, and good morning to everybody, and thank you for the introduction. It's a pleasure indeed to present our latest work on the link between environment and health. And we are launching a new report that has the title Healthy Environment, Healthy Lives, which is in a nutshell also the conclusion of the report. We need a healthy environment if we want to lead healthy lives. It's a report that is based on our own best knowledge on environmental stressors and how they impact health, but it was done in close collaboration with the World Health Organization and their work on a similar topic. Now, when we look at health and environment issues in Europe, we see that there is a rather large discrepancy between areas in Europe and how life expectancy is linked to GDP per capita. And the difference between European countries, and you should be seeing the next slide now, which is not the case. But anyway, there is an 8-year difference in life expectancy between European countries, and in general we can say that poorer people live shorter lives, less healthy lives, they have more long-term health problems, and they also have a stronger self-perception of poor health. But it's not equal across Europe. We see some patterns here. One pattern is that those who live in a Mediterranean environment are not as affluent as some other countries, but they have a longer life expectancy. There is a group of countries then that is richer per capita, but don't have the same life expectancy. Countries like Denmark, Germany, Belgium. And then there is the countries mostly in Eastern and Southern Europe that have a lower income and a lower life expectancy. In the report, we look at how these patterns are linked to environmental issues. And we know that in Europe, about 1 to 7, 1 in 8 people die linked to environmental factors. This comes from the really great work that the World Health Organization is doing. And if you look at those, 90% of those are coming from non-communicable disease. We know that about 250,000 people die of cancer that can be linked to environmental factors. About 130,000 die of ischemic heart disease. We also know that a lot of people die because of chronic obstructive pulmonary disease. But lesser known maybe is that mental, behavioral and neurological conditions can also be linked to environmental issues. Diabetes, so there are many diseases, non-communicable diseases that we can link to environmental issues. Now, if we look at how that plays out, we can start with the most important factor, and that is air pollution. From our own work, which we do in our annual air quality report, and from the work of the World Health Organization, we calculate that about 400,000 people die in Europe prematurely because of poor air quality. It's responsible for about 1 in 6 deaths from lung cancer, about 1 in 8 deaths from ischemic heart disease, and about 1 in 10 deaths from stroke. And what you see on the map is very clear, I think. There is a pattern that is geographic. If you go to southeastern Europe and Eastern Europe, it's clear that there is a higher impact. But we also know from our own more in-depth work on this that there is a link with income and with poverty. People that are disenfranchised in various ways suffer more from this, whether it's poor people, people that are more ill, elderly people. So we see these patterns very strongly represented here. When we look at the second environmental risk, which is noise, and we just did this year a noise report that looks at this in more detail, we know that about 1 in 5 people in Europe live in areas where noise levels are deemed unhealthy. And that is mostly coming from road traffic. And the bad news is that that is increasing and that we are not living up to European policy objectives, which was that we would decrease the number of people living in unhealthy noise levels. There is a clear link with sleep disturbance, which has all sorts of consequences, also with heart disease, premature mortality, and very importantly, also with the cognitive development in young children. The social distribution here is less outspoken maybe than in air pollution, but we know that people who live in poorer quarters of cities often have additional noise levels to deal with. But it doesn't stop there. There are many other factors that have an impact on environment and health. Climate change, for example, heat waves, and we have seen just this summer what heat waves do to public health on top of this summer, the COVID-19 crisis. Extreme cold can play a role. Floods, which can ruin houses that then become less healthy to live in and also has an impact on people's mental health. The vectors of disease, which we see changing. So the link between climate change, which is happening and which is more and more impacting Europe and health, is also very clear. This impacts children and older and people in poor health condition more. And also it's more difficult to deal with this if you are in a less favorable economic condition. The report also looks at unknown and emerging risks, and those are often underestimated because we know less about them. And of the global burden of disease, the World Health Organization estimates that about 3% is coming from chemical exposure, but we have a serious knowledge gap there. Of most chemicals, we don't really know how much they impact our health, let alone what it does over longer periods of time or when it's mixed with other factors. The same can be said for poor indoor air quality, which we know contributes to ill health, but we know rather little about the burden in a European context because we don't do systematic monitoring, and so it's very difficult to make the link. We also know that antimicrobial resistance is an issue that is increasingly studied and that also has a link with environmental issues. So multiple causes to take this relationship very seriously and to keep investing in a stronger and more up-to-date knowledge base. Now, the good part, or the good news, is that actually there are things that we can do about this. We can look at green and blue spaces in the city and their benefits, and we can actually look at nature as a public health tool. More green spaces in cities lead to more active lifestyles, healthier air, less noise pollution, access for disadvantaged people to parks, and they are often deprived of that. So there are many aspects that we can actually focus on that are low cost, that are no regret, and that overall improve the life and the resilience in our cities. And honestly, I'm sometimes amazed that this is not picked up more by local politicians, because it is really a cheap way and an easy way to build social capital, improve the health in cities, and work towards the future. Of course, you cannot speak about environment and health today without focusing on COVID-19. And the report also has a chapter on that. We know that it's a zoonotic disease that jumped species from animals to humans, like other diseases have done, Ebola, SARS, others as well. So there is clearly a link with the relationship between human beings and society and how we live in an environment that is increasingly under pressure. There are also strong indications that air pollution might be linked to higher death rates from COVID-19. And if you put on that the ill health of more disadvantaged communities and the fact that they live in poor air quality, you know that there's also a strong social dimension. Another element which I think is emphasized by the World Health Organization for good reason is the critical role for WASH, water, sanitation, and hygiene. And again, it's the most marginalized people, even in Europe, that lack access to these very basic things. Think of refugees, think of people who live on the street, of disenfranchised communities like the Roma in Europe. So we know that there is an issue as well. Also, from environmental monitoring of wastewater, we can make links to the monitoring of the spread of COVID-19 and the prevalence. So there are several connections there, but they are under further investigation by researchers in Europe. Luckily, we now have the European Green Deal, which sets high ambitions, and this is presented as an environment and climate agenda, an investment agenda, a competitiveness agenda, but you can also look at it as a health agenda. Because if we fully implement the European Green Deal, we will live in a more healthy environment, which will have massive impact on the health of European citizens, with fewer costs to our healthcare systems, longer and healthier lives, and overall a more productive society. And I do not mean that only in the economic way. I think it's clear from the presentation that investing in nature is not only a win for nature, this translates into a healthier environment in which we live. It has positive impacts on our health. And if we pay attention to the distributional aspects, it can also lead to better, stronger, more equal societies. So I would say if we focus in our climate and environment policies more also on that social and health dimension, that would be an added benefit. And at the same time, when we create new policy trajectories for health in our societies, we should take environment and climate issues more seriously, and in addition, the distributional aspects of those policies. To wrap it up, I think it is clear that Europe is improving environmental issues. We see improved air quality, water quality, but overall, it still is a very serious burden on European health and our healthcare system. So we have every reason to take this relationship very seriously and also to focus on a stronger knowledge base, because there are still quite a lot of unknowns. And I'm happy to engage in the debate with those who are online and, of course, the other speakers. Thank you very much.
Excellent. Thank you very much, Hans. And I'm sure people will be very interested to read the report and find out more about it, and it's available on your website. Let me pass the floor now to Anne Stauffer, who's the Director of Strategy and Campaigns for the Health and Environment Alliance, HEAL, to give us a viewpoint from civil society, because I'm sure you're going to want to pick up, Anne, on the key message that came through from Hans, that it's the distributional aspect of air pollution, of poor environments, that has such an impact on health, and we can see it in life expectancies. Anne, let me pass the floor to you.
Good morning. Thank you very much for the invitation and giving me the opportunity to speak this morning and present some views of the health community of HEAL, our alliance of over 80 member organizations working for better health through healthier environments. And also thank you and congratulations to Hans and the EEA for bringing out this report and gathering this wealth of information and really making clear again all the links between a healthy environment, a healthy climate, and our health. And I think this report could not come at a more timely moment, as we're actually in the middle of the debates on the recovery from the COVID-19 pandemic and on setting the EU and Europe on the course for greater health resilience, for preventing ill health and pandemics like this in the future. And making investments into health prevention. So I wanted to focus my intervention this morning on what needs to happen politically and talk a bit more about the need to actually recognize, or what does it mean to recognize that our environment and the climate, our health, are intrinsically linked. And my main message for this morning is that EU policymakers need to walk the talk on greening the economy, on protecting our health, and on moving us to zero pollution. As Hans mentioned, we have the new policy context of the EU Green Deal, which it's important cannot be underestimated. But we need to make these commitments that are in the Green Deal and all the announcements we've heard in the past months and turn them into tangible actions and actually decisions. And this is true for actually the national governments, this is true for the European Parliament, and this is true for the European Commission. So I'm going to talk about all three of them in the next minutes. And start actually with the Council and the recent agreement that has been hailed as historic by many for the next EU budget and also for the EU Recovery Fund. But it's also given us a big disappointment in terms of the cuts in investments into our future. There were cuts in the proposed health program, there were cuts in research and innovation, and also cuts into the Just Transition Fund, which is a key fund to help those regions where fossil fuels are still dominant, to really move and transition to decarbonization, so further us all in the need for greater climate protection. So we really need to see strong investments into a healthy future, and we're looking to the European Parliament to rectify this actually in the next months, as the discussions are still ongoing. But it's also an invitation for all of us who want to live healthier lives to hold our national governments accountable and really watch what they're doing, not only in what they're negotiating in Brussels, but in addition to what is being decided now at national level with all the recovery money, all the money that's been made available, to make sure this actually goes into better health protection, into a greener future, and into creating more just and more society. And in addition to making the right investments, what we also need to make sure is actually that we disinvest from the fossil fuels of the past. So it not only needs more investments into greening the economy, it also really needs a clear exclusion list and exclusion criteria for climate and the environment to make sure that we do not see any investments into fossils anymore, which would lock us again into the same problems. As overall, a healthy, green, and just recovery, it's not something optional. I think it's really a necessity and a must, and the policymakers have to really heed the call. So I mentioned the member states and I mentioned the European Parliament, but I also don't want to let the European Commission off the hook, as we're waiting for some further proposals stemming on from the EU Green Deal. And this relates first to a proposal to upping the EU's climate target for 2030, where we know that the current one is completely inadequate of what the science says, and completely inadequate of the urgency that is there to addressing climate change. So we need to see a move to at least minus 65% greenhouse gas emission reduction target for 2030. We're also waiting for a chemical strategy. Hans mentioned there are still so many unknowns around chemicals, but we know that there is a great health burden from exposure to hazardous chemicals. And we're expecting a proposal for a sustainable chemical strategy that really needs to live up to its name and have health protection and the reduction of exposure to hazardous chemicals at its core, not furthering increased chemicals production in Europe. And last but not least, zero pollution is key. It's key for our organization, and we do want to see an ambitious proposal next year, including the alignment of the EU equality standards to what WHO and what the science says, as we have important protection gaps. And let me just make a quick word on Eastern Europe, because that was something that I found really striking in the report, that the environmental burden of disease is higher in Eastern Europe, and it's something that indeed should be a wake-up call to all of us, and underlines again how important it is that the recovery money and the EU budget, the funding, goes into the right measures and into those that finance our future and modernize the infrastructure. I'm thinking here of the energy system that in Eastern Europe is still very much dependent on coal power generation. So we need to make sure that there is no funding for coal in recovery, for example, for the Polish coal sector. And we also need to advance on greening the Western Balkans. In Bosnia and Herzegovina, the environmental burden of disease was the highest. And clearly we need to see some further proposals on greening the Western Balkans, especially as there are still investments foreseen by the Chinese into coal power generation in that region.
Excellent.
And my last point would be, we've had many of these conversations in terms of what needs to happen policy-wise, the data, but I think we're also at a different point. Tamsin, you mentioned how all of us were affected by COVID-19 and are still affected, and I think there's a lot of soul searching going on, and a lot of people are thinking about what is really important in my life, what do I need to be healthy and happy. And I think there is very much a willingness for change and for doing things differently among people. And I really hope that our policymakers will hear that desire, that strong desire and that wish, and set the sail for a healthier future. Thank you.
Okay. Thank you very much, Anne, for highlighting some of the areas where civil society is really looking to see action taken by the institutions to make a change, and also highlighting that across Europe there is a very different impact, and just over the EU borders are areas where some of the worst burden is falling and the worst health, and so we have a responsibility there. For those of you who would like to ask questions, please feel free to raise your hand through the chat on Zoom. And if you're watching on the live stream on Twitter, you can use the hashtag FOE-debate if you have a question or a comment. I'm going to move now to our next speaker. Hans, you mentioned the report was developed in collaboration with the World Health Organization, and our next speaker, Francesca Racioppi, is the head of the European Centre for Environment and Health of the World Health Organization in the European region. Francesca, what would you like to add to our conversation about the link between environment and health? You need to unmute. Excellent. Go ahead.
Thank you. You should be able to hear me now. Yes. Okay.
Yes.
So good morning, everybody, and thanks a lot for inviting me, representing the World Health Organization, to this event. And thanks to Hans for introducing the report. From a World Health Organization point of view, let me start by saying that we are very pleased to see that the work, the methodologies, the approaches, the evidence that our organization is offering to policymakers, to member states, and to the general public could come to fruition in the preparation of this report. And this also underscores one underlying point in Hans' presentation, and it is the one of joining the dots and partnerships. How much can we do and achieve when we are joining our respective areas of expertise and knowledge, and we can row together in the same direction. We can add the value to the decisions that are going to be made. And this is a lot what is into this report. So we are welcoming the report, of course, because as Anna said, it's highly timely. It is being issued at a point in time where critical, paramount decisions are being made by governments in the attempt to recover now and to build back after the COVID-19 crisis. So coming forward with some strong evidence which tells us which are the big environmental and health issues, which points at where we can make a bigger difference by addressing inequalities. And some of the directions for this work is highly informative, and I really hope that policymakers will be using this report to support their decision making. From our point of view, of course, we are very much concerned by the effects that environmental pollution has on health. Hans was reminding us that in this study, air pollution came across as the single most important pollutant and risk factor for health for European people. Nearly 400,000 deaths per year is an incredible number, and it is something that is particularly serious because there is a lot that we could do about it. And then, of course, it comes with the issue of where are we prepared to take action to address these issues. For example, when it comes to air pollution, of course, it is not just one single sector who will be able to address it. You need to make big decisions and difficult decisions when it comes to policies on energy, on transport, on agriculture, on clean production. And at the same time, I have to say that a shock, a tragic event, an unfolding tragedy like COVID-19 has shown to us that change at some point must happen, and there is really little time to plan and to think and to ponder about it. Nearly all countries over the past months have been experimenting with completely new policies that were unthinkable until a few months ago. Just to think how many cities have been retrofitting their transport infrastructure to allow more people cycling and walking, perhaps not so much because they were thinking that this is good for their health, which is, but because they came to realize that they needed to strengthen urban resilience. For example, by giving people more opportunities to move around in a healthy and sustainable and safe way, and decreasing the pressure on public transport so that people who need to use public transport could continue to do that safely. So COVID has been a big game changer, but it has also helped us to focus on what is really of importance. And this is another element that comes across from the new report released by the EU today, the link to the environment, to the integrity of our ecological systems. It's not just about protecting a few endangered species. It is about protecting the survival of human beings. It is about protecting ourselves and the generations to come. All these efforts have to come together. There is a huge opportunity to link the air pollution agenda to the climate agenda, because very many of the same policy options that we have are applicable in both cases. And if we join these two agendas, joining the climate change and the air pollution agenda, we are also going to multiply the benefits from the investments into that, because we would be ripening immediate benefits from health improvements, while we are also addressing the longer-term effects of climate change. From a perspective of a policy environment, this is also a very special point in time, Because on the one side, the EU is coming forward with the EU Green Deal. It can be a lighthouse in terms of supporting the development and the investment into the right direction. At the same time, from the WHO, we have come up with the WHO Manifesto for a Healthy and Green Recovery. All these elements are pushing and pulling us in a new direction, and we really hope to see policymakers going for it and understanding that this is a completed new way and a good way of reviving our life and protecting our environment for the future of our generations and for the future of our planet. My last point is really about this. We have got knowledge, we have got evidence, we have got policy options. Now it is the time to get up and try to implement this all. Thanks a lot. We have a not to be missed opportunity. Let's not really waste it and work together towards that objective.
Excellent. Thank you very much, Francesca. I invited the audience to submit questions, and we have a question that is coming from Angelica Poth-Murgele. She has a question to our panel and possibly to Hans. Angelica, we're going to pass the floor to you. Would you like to ask your question briefly, please?
Yeah, thank you very much. Well, in fact, it wasn't really a question. It was a comment. I very much appreciate that Hans highlighted the role of cities in adaptation to climate change and how much can be done. Just probably to react to that, he said cities could do more. And I would just like to say a lot of cities are already implementing a lot of measures, but of course they cannot do it without the legal framework, without the financial support, etc. So it really needs a good collaboration between all levels of governance, and that includes in particular central government and the European level. But I would really appreciate if we could all work in this direction. This would be really very necessary and useful. Thank you very much.
Angelica, you are from the CEMR, which is the Council of European Municipalities and Regions. Is that correct? Is this something that do you feel that your members have at the top of their agenda this strong connection between environment and health?
Very much, because they are in the forefront. Just taking the example of the COVID crisis, they were put into the situation, they had to handle the situation. And what we observed, we have created a task force on COVID, where 34 of our member associations participate, which is quite a lot. And it becomes more and more obvious that now, after the first weeks and months of experience, countries are, if you can say so, localizing the management of COVID, because it has demonstrated that it's most effective to handle the situation in the local government, in the cities, municipalities, and regions. So this puts even more responsibility on the local and regional governments. And indeed, that's what we are focusing in our organization, which is the pan-European umbrella organization of local and regional governments, not just only covering the 27 EU member states, but all in all, we cover 40 countries, and we have more than 60 member associations.
Excellent, thank you. And in fact, you've given us a nice bridge to our last speaker, who will be speaking in a few minutes, Katarina Luch from Stockholm. But before she speaks, I'd like to give Hans a point to perhaps say something about the role of cities and local government.
Yes, Angelica, good morning. I couldn't agree more with you. In many cases, cities do indeed have high ambitions, and ambitions that are significantly higher than national governments when it comes to dealing with climate, or when it comes with managing traffic in a more sustainable and environmental way. So, and you do it, of course, in a context that is determined also by national policies, tax policies, investment in infrastructure. So I couldn't agree more. In fact, we are also working on a highly integrated report on the role of cities in delivering these promises of the European Green Deal and of a climate agenda for the future. But I can only support your point that cities play an important role, but that they do it in collaboration with the other levels of government. And we are connecting to the Committee of the Regions, we're connecting to the big associations of cities in Europe also to discuss these issues. So thanks for your comments.
Excellent. So let me now pass the floor to our final speaker on the panel this morning, Katarina Luch, who is the Vice Mayor for Climate and Environment of the city of Stockholm. Now, we've just had a conversation about how cities have this important role to play, but this equally important for cities is the fact they have to support the economy. And with COVID, large proportions of the economy were closed down, and people are very keen now to get back to work, get things to restart again. But from the point of view of the environment, we don't need that. We need something completely different, which is a real challenge for local policymakers. So Katarina, how do you square that circle? What are you doing in Stockholm?
Oh, thank you. I would like to start by thank you for underlining the importance of cities in this work, but also to underline the importance of national regulations and national policies and EU policies to help the cities to do what we have to do in the cities. As we have heard today, environmental degradation has the largest impact of the most vulnerable in our communities, but not only from a global, but also from a local perspective. And in Stockholm, we can clearly see how the increasing frequency of summer heat waves is causing stress in our elderly, and how the heat also is accelerating the spread of poisonous algal blooms in the Baltic Sea and in our lakes. And such blooms affect every citizen negatively, but they can also be especially harmful for the least affluent in our community who do not have the means to travel somewhere else. And sustainability has long been a focal point for Stockholm. We are one of the few cities worldwide whose climate policies are compatible with the goals of the Paris Agreement, and we are already on track to becoming climate neutral by 2040. But we know that more has to be done. That is why we recently adopted a new plan to make Stockholm not just fossil fuel free, but also climate positive by 2040. Earlier this year, we closed down our last remaining coal power plant, and we are also in the process of adopting a new biodiversity strategy, another important step in doing our part of the work for providing a healthier planet for everyone. EU policy has a significant impact on the work we do in Stockholm, which is why I strongly support the European Green Deal. I believe it provides a coherent pathway towards a green, just and healthy future. And it has a real potential to protect and preserve our nature, the foundation of human health. The terms of Europe's recovery from Corona will have a decisive impact on the Green Deal. And even though it's positive to see climate and environmental action feature so prominently in the EU recovery plan and long-term budget, some development do worry me. And I would give you two examples of that. One, the calculated investment needs in the proposed EU recovery plan is based on the current 2030 climate targets. And as we all know, and has also been mentioned today, the 40% target does not allow us to meet the goals of the Paris Agreement. And without a more realistic assessment of the actual investment needs, I believe it will be exceedingly difficult to achieve the goals of the European Green Deal. Directly linked to this point, it worries me that several EU member states are pursuing national recovery plans that are incompatible with the goals of the European Green Deal. Examples include unconditional financial support for airline companies and other fossil fuel-intensive industries on proposal to subsidize the purchasing of cars with internal combustion engines, which make goals for both climate emissions and air quality more difficult to reach. The Internal Energy Agency estimates that worldwide fossil fuels subsidize total nearly $400 billion, and that is our tax money being used to sustain systems that we should already have replaced a long time ago. That said, I believe that the response of EU member states to this current moment belies the urgency and severity of the different crises we are facing. However, I would like to end on a more positive note. As we all know, Corona has dramatically sped up the transition toward digital solutions, and remote working is one of them. There are many indications that this new way of working will carry over to post-Corona future. That does open up many opportunities. Less commutes to work could mean less congestion on our roads and less CO2 emissions. And with less people flocking to the city centers, we may also see a vitalization of neglected districts in the periphery of the city that currently lack the kind of services you would normally find in the city center. We also have the concept of staycation, that may have given a second life thanks to Corona. With less people choosing to travel abroad, there is an even greater demand to build cities that can provide its citizen, culture and recreation close to where people live. In Stockholm, green areas and clean waterways are key in this context, and we could see over the past few months how our citizens have flocked to the 10 nature reserves we have in our city. Also, different water sports as kayaking, boating and stand-up paddling has been increasingly popular in the city this summer, and our city beaches have been crowded. Expanding the number of urban green areas and improving quality of water were already among my priorities before Corona. Now there is a whole new urgency among these kinds of investments. This kind of work also goes hand in hand with our effort to improve biodiversity in our city, to adapt the city to climate change, and at the same time improving the quality of life and health of our citizens. So, summing up, there are many challenges, but I truly believe that there are also a lot of opportunities. So thank you.
Excellent. Thank you very much, Katarina, and how interesting to hear the ambitious plans that you have in Stockholm. You know, we've had quite a lot of numbers thrown around in our conversation this morning. Hans, you said that there's the goal of 40% of reductions by 2030, but actually we need to, the European Commission has now recommitted to something a bit more ambitious, 55%, but you also said that actually realistically we need to be going to, I think it was Anne who said we need to go to 65% by 2030. These are extraordinary changes that need to happen. I'm inviting our audience, if you'd like to submit a question, please feel free to do it. If you're on Zoom, raise your virtual hand. If you're on Twitter, you can send a message using the hashtag #FOEdebate. We welcome your questions and input. While we're waiting to see what our audience has to share, let me ask our panelists, to what extent is this the real wake-up call? And do you think that politicians are going to be able to resist the pressure to get the economy going by doing the stuff we've always done before? So, for example, you know, Katarina, you spoke about the fact that teleworking is going to be more usual. That's fewer people coming into the city centre, but that means all of the associated cafes, restaurants, dry cleaners, and all the other shops that are around that are going to disappear. Those are jobs. Now, politicians, having spent a lot of money for COVID, are under real pressure to kickstart the economy. And yet what we're saying is, don't go back to how things were. Do you feel that there is the political will to essentially create a new economy fast enough to achieve recovery? Hans?
Well, I think it is the clear message of the European Commission that is the goal of the investments that should be linked to the European Green Deal and also the stimulus package that is out there. And we also notice that there is a coalition of countries in Europe that are actually doing this in their planning to grow out of this economic and social crisis. I think the French government has made a very clear statement there. It's also obvious that the German package is also focusing on the sustainability issue. And it's also what was discussed at the European Council level. So in that respect, that is clear. Is there a tendency, however, to think that investing in the systems that we already know, the technologies that we know, and making those a bit more effective and efficient and environmentally friendly, that is a green investment? Yes, but that there is a limit to that. You know, it's marginal improvements of what we know. I think if we are really serious, we should be focusing on investments that are really opening up these pathways towards carbon neutrality, zero pollution, and that means working with the chemical sector. That means working with our transport and mobility system, the real breakthrough investments in our energy system. And as a major additional benefit, we would also have health benefits associated with that type of breakthrough investment. So the biggest danger, I think, is that we make investments that are in the end dead-end streets, which means we make them now. Afterwards, we have to make additional investments to reach our sustainability objectives. And on top of that, we will be doing it on the bill, on the account of our children and grandchildren, because already we're talking about, you know, these payback periods for the loans well into the 2050s. So making the right investments, avoiding double double paying for it, and knowing very well that we will also save money by making those investments in our healthcare systems, in our mobility system, in how we deal with climate change over the longer term. I think that that's where the real challenge is. And that is indeed the intention of the package that has been put down by the European institutions. That is the core spirit of the Green Deal, I would say.
Okay, thank you. I'm really struck by something that you said. You've spoken a lot about investments. And of course, public money isn't the only money out there. And I'm wondering to what extent the private money, company money, corporate money, banks are also realigning their investment strategies. And maybe Anne from HEAL, you might also want to come in on this, because the kind of society shift that we need, that you've all been talking about, yes, governments can have policies and they can make their own public investments, but by far the larger amount of money that's available for investing in our economic systems is private money. Anne, is this something you'd like to comment on? Do you see private investment aligning with this big political vision?
I think what's really important in this situation is that we cannot underestimate the importance of investments. And Hans, you were talking about change, or we were wondering about change this morning, and I think already before COVID, the change actually started to take place. If you look at all the jobs that were created in the green economy, there were thousands of them in the past year. If you look at the energy sector, at least in Western Europe, coal, the importance and the contribution to coal to power generation already declined before COVID started. It was then accelerated by the crisis as the energy demand went down, and this is when renewables went up, and we had several countries where we went for weeks on renewables only. And I think so. The change has started to happen. It's now about making the right investments. So, for example, in energy, it's really going for 100% renewables and energy savings instead of now investing into more gas and converting our coal plants into gas plants. As Hans said, this will lock us in again. And indeed, it's for the private investments. What we need as well is the right political conditions to enable the whole greening of the society.
Okay, thank you very much. So, Hans, you said some countries you can really see that their recovery package is aligning with this vision of where we need to go over the next few decades. And Anne, you've said that actually some of the trends in investments we could start to see happening. We've also now got another question from someone on Zoom. So Caroline is from our Friends of Europe team is going to bring forward some questions that have come forward actually on the Twitter. So Caroline, can we hear from you, please?
Yes, thank you, Tamsin, and thank you to all the speakers for their great contribution. We've got one question from the online audience, and that is, climate change will make the impact of environmental pollution and inequality worse. How can we tackle these interlinkages? Yes, our online community would be very interested to hear your thoughts on this.
Okay, so this issue of inequalities, it was raised by every single one of our speakers in different ways. I think clearly it came up in this issue of distributional effect of our investments, our resources, and the impact on health. Hans, I'm going to ask you to do that, and then Francesca, I'll bring you in as well from the WHO. Hans.
Well, thanks for the question. I think the first element is that we need to understand that serious decarbonization and sticking to this carbon neutrality is absolutely necessary. And then on top of that, we need to take the climate adaptation strategy much more serious. It needs to be implemented in what we all know now is a pivotal decade. It needs to happen now. And then on top of that, I think we need to understand that social and distributional issues, health issues, are an integral part of the climate impacts and vulnerabilities that are out there. So rather than dealing with those as an externality of our policies, we need to fully integrate that dimension in our policies. And I think if we do that, if we make policies understanding that they take place in a societal context that has distributional aspects and that we can link it to policies, then we can really start addressing this. For example, in the social housing sector, you can do a lot on climate mitigation, but also adaptation. And this is largely a public-private type of investment. So paying attention to those connections as a fundamental and structural element of the policies and not as the next externality that we then need to solve later, I think is the key element for policymakers.
Thank you. I'm actually going to pass the floor now to Katarina from Stockholm, because some of the points that we just raised about investments and inequalities, I think, are really sit on her desk as a political leader. Katarina.
Yeah, thank you. I think it's really important to invest in the overall fossil fuel-free infrastructure, of course. And I think all the investment that we do in the city to increase life quality is also very important for all our citizens, especially the ones that has to remain in the city, that has to work here. So I think investments in public transport, for example, is really important. Investments in the beaches we have in the city, in the green areas, and also, of course, the climate adaptation that will help people to have better lives during summers and winters and during heavy rains, of course. I would also like to comment on the way that we've talked about that cafes are closing down in the city centers. I think that's really important also that this, as we see in Stockholm, in the suburbs, for example, the city or the centers are really thriving now, that they have new cafes, new bakeries, and new restaurants because people do their shopping there instead. So I think we also have to realize that there's a change in the pattern of how people are consuming. But I also think we have to push in the right direction and to invest in fossil fuel-free transports, for example, to the suburban parts. So there's many things to do, and there's so many things to talk about.
Yeah, true, and never enough time. But let me, we have another question that has come in, and we're going to pass the floor to Svetlana Filipova. I hope I have pronounced your name correctly. What would you like to add to our conversation?
Thank you so much. I'm indeed Svetlana, very nice pronunciation, from Institute for European Environment Policy, and I'm in charge of exactly this interlinkage between environment, health, and well-being. And I wanted to bring the discussion in a different question. Indeed, we have looked into the massive amount of positive measures which were introduced as a post-COVID recovery measures, and they were beneficial for the environment and for human health. But I'm concerned about the return to single-use plastic and extra packaging, which is very much justified because of human safety and, again, well-being. So I was wondering whether the EA report or the WHO have looked into exactly this impact of COVID, the return to single-use plastic. Thank you.
Okay, thank you. That's a good point, because and it's hard to remember a time before we had the climate strikes, people on the streets, and COVID, but actually that was the big campaign in early 2019, was to get rid of straws and single-use plastics. So I'm going to invite Francesca from the WHO to pick up on that one. And just as a reminder, the report that Hans launched this morning on Healthy Environment, Healthy Lives is available to download on the European Environment Agency website. It's got a lot more detail and maps and information, so please feel free to do that. Francesca, can I ask you to respond to this issue that, having made good progress towards trying to get rid of single-use plastic, as a result of COVID, for hygiene reasons, we went back to that, not least because we've now got surgical masks that you can find in all the litter everywhere, disposable gloves, disposable plastic coverings. So for hygiene, we went back to something that we had been getting rid of. So how does the WHO see these two contradicting trends? Francesca.
Yeah, thank you. And this is really a very, very important question, and we have seen a very significant increase in the production of waste, which of course goes counter the kind of trend that we would like to see. Of course, whenever we are assessing what is happening, we have to put on the one side the benefits and the risks of it. And at this point in time, of course, the emergency and the need to look at ensuring that we are mitigating and preventing the spreading of COVID-19 makes it necessary to provide and to help people to be to protect themselves with the most appropriate devices. This doesn't mean that we are going to have a free-for-all coming back to one-use plastic, because at the same time, if we have to accept and to take as a society, at least for a short period of time, because also there can be opportunities for improvement. We have already seen, for example, that for the general public, we can recommend and we can use washable masks. So there is no need to have all the time fully disposable masks, and this equipment can be reserved for the personnel who is the most exposed, like people working in the healthcare services, for example, or with a very close exposure to the public. So we can become better at managing also the use of these devices, but we have to continue and heighten up our commitment to a solid waste policy. So going about we have to continue to go to the largest extent possible, avoid the use of new resources, recycle whenever it is possible, and then have only the residual that goes into the environment, following also the EU policy approach to that. So
Okay.
we have to accept some also temporary part of increase there, while at the same time strengthening the waste management policy. Particularly the urban one has been particularly challenged because medical waste has its own stream and ways of dealing with that.
Excellent, thank you. Now, as we said earlier, we're running out of time and there's still so many interesting things to discuss. But just before we close, I'm going to invite our speakers. And Francesca, you've just had a chance to speak. So I'll start with Anne. Looking at the 2030 goals, which are, we need to actually be even more ambitious than the goals that were set in the Paris Agreement if we're actually to achieve healthy, sustainable lives. What actions do you think we need to see in the next 12 months to show that we are actually walking the talk, as we've said, that the politicians need to take action? And what do you want to see in the next 12 months?
I would like to see two things in creating the right conditions for further change. And one is I want to see more ambitious health protecting and promoting air quality standards, as those will actually prompt then the cities to take further clean air actions, as the current one have done. And I want to see higher EU climate ambition for 2030 to address the urgency of tackling climate change and again to protect health better.
Excellent, thank you. Katarina, what would you like to see happen in the next 12 months to show that we're walking the talk towards delivering on our agenda for 2030?
Also two things. First of all, new stronger regulation and policies around road traffic and transport and delivery. We really need to do something about the cars if you think about both health issues and the emissions of CO2 and noise levels. So I think that's the most important thing, to actually take a whole grip of the road traffic. And then I would also like to see stronger planning for nature-based solutions in cities when it comes to climate adaptation measures.
Okay, excellent, thank you. Francesca, do you have two things on your wish list that you'd like to see action on before I pass to Hans to complete?
Well, much of it has been covered by my predecessors, but it would be great to see in a year from now that a growing number of parliaments and a growing number of city councils are passing or going through bills and new regulations that walk the talk of what we have been discussing. And excellent. I would like to see every child in every school throughout Europe to be able to wash their hands and to have the opportunity of practicing what we are preaching. And finally, the air pollution and the climate change, there will be never enough emphasis on the importance of addressing these two. It is vital, it is linked to the economy, it is linked to the future of our planet, and it is linked to our own future and the future of our generations.
Thank you.
Absolutely. Let's go and do it.
Perfect. Hans, let's go and do it. Air pollution standards, stronger climate ambitions, dealing with roads, transport, and nature-based solutions. That's quite a wish list in the next 12 months.
Yeah, but it's necessary. Science is telling us that it's necessary, and people who think about policies for the future tell us that it's possible. So let's do what is needed and what is possible and make the right type of policies under the Green Deal ambitions, translate that in strong policy trajectories, and connect that to a big investment portfolio in Europe, which can be strengthened by the Sustainable Finance Initiative and the taxonomy that is out there now, and then make the right choices. And that not only means investing in what we need to see speeding up, you know, the breakthrough of these new solutions. We will also need to focus on what we need to stop doing and what we need to move out of, because that will create a space for a faster and necessary breakthrough of where we need to go. And then we can understand that environment policies and health policies can be much closer aligned, because they're still often operating in silos, rather far away from each other, where we understand that they are intimately connected. And in the end, this is about citizens, our quality of life, and also the future, not only for the planet, but for our children and grandchildren. So that's, I think, where we can go.
Excellent. Thank you. Thank you to all our panelists and for you for joining and participating in this conversation with Friends of Europe. You will be able to download the report that's Healthy Lives, Healthy Environment from the European Environment Agency website. The recording of this will be on the Friends of Europe website that you can share and distribute with friends. For those of you who are on Zoom, please stay on the Zoom after we close the live stream. You're welcome to continue the conversation, to share your ideas and see where we can go forward. I've been delighted to have this conversation with you, and there will be future events coming up on your screen from Friends of Europe that you'll be able to participate in the coming weeks. Thank you, stay safe, and speak to you all soon. Now, you'll be able to speak and share. This is a community of people who are committed to trying to do something. The floor is now yours. Thank you.